Upfront Conversation, the podcast where we tackle topics that matter, head on and without hesitation. Today we're incredibly excited to introduce a brand new series, a new space with our conversation that we believe is absolutely vital. This is Tabooless and Unmuted. You know, for too long, conversation around women's health, particularly womb health, has been whispered, ignored, or simply deemed too personal for public discussion. This silence and lack of open dialogue has left countless women feeling isolated, misunderstood, and often without crucial information they need to advocate for their own well-being. And this is precisely why we're launching this Tabooless and Unmuted. This series is dedicated to breaking down those barriers, dismantling the taboos, and giving a powerful, clear voice to experiences that have been unmuted for too long. I'm excited to embark on this journey with my incredible co-host. Joining me today from the entire series is a woman that is dedicated to women's health and is truly inspiring. Please welcome Jen, the brilliant mind and passionate advocate from The Weight. Jen, it's an absolute pleasure to have you here. From our listeners, can you tell us a little bit about yourself and the incredible work that you do with The Weight UK?
Hi, thanks Caroline, and it's great to join you on this new podcast, Tabooless and Unmuted. So yeah, really hoping that we can amplify voices and really change the narratives around womb health, fertility, reproductive health and preconception care. So as you said, I'm Jenny Akona-Mensah, otherwise known as Jen, and well, a bit about me, I kind of speak centered from lived experience because my womb health has really been central to how I've lived in the world, you know, how I've lived psychologically, how I've lived in my body, how I've lived in terms of connection. And so I found myself at 16 having very painful periods, and many people will be able to relate to that. It wasn't taken seriously, and it took until I was about 21, which is relatively early to get a diagnosis of endometriosis. That really interfered with my schooling. You know, it also interfered with university. I've spoken a bit about how I had to leave the Brit school previously because basically I was in so much pain. I had heavy bleeding, painful periods. Unbeknown to me, I had endometriosis. And so very much I was finding it difficult to sort of navigate my way as a young woman in the world who wasn't wanting to just take hormones or wasn't thinking about becoming pregnant. And I got my diagnosis around 21, like I said, and going on from then, you know, into several years later, there were various reproductive health, womb health issues that I was plagued with that we are talking a bit more about, you know, because there are so many women suffering from things like fibroids, endometriosis, adenomyosis, all these types of conditions that affect us. So this really to speak to those people and for our voices to be heard. You know, it's about policymakers, it's about decision makers listening to the impacts that this has on our lives and what the changes we want to see. You know, we want to see change. It is a call to action because we need change. And I'm here to talk about, you know, the work that I've been doing in the sector to advocate and bring about that change.
Yeah, thank you. I mean, I just wanted to highlight that we've worked on a few little bits before this podcast because I was introduced to you by somebody else, another organisation, Soul Purpose 360, because I wanted to have a conversation around Black women's womb health because I'm going through life and I too have lived experience with fibroids and, you know, I was going through the heavy flow and so forth and how it impacted me, and I was starting to talk to people and I'm hearing they're going through it too and they're going through it too, and it was like, oh, okay. But no one really says anything until you kind of say that you're going through this, and then I'm going through this. Back in February, we worked on a project where we brought women together, which was a safe space for people to share, which was quite impactful. We created a video out of that, and we've done some focus groups together to get people's journeys and understanding so we could create a report for anti-racist policies within the health services and feedback to them about what women are experiencing when it comes to womb health. And, you know, and it only made sense to continue some of the work with yourself, with your journey within the sector, and now you've gone on to set up your own organisation, The Weight UK. Can you tell me more about The Weight UK and why are we having to have this conversation about Black women's womb health?
Absolutely, yeah. And I mean, it's been a pleasure to work alongside you and to be doing some of this work. I previously was working for a charity that was one of the leading fertility charities in the UK, and I was leading a project which focused on providing fertility support and access for people from ethnic minority communities. It banded all ethnic minority communities together. However, we did have support groups for different cultures and ethnicities within those ethnic minority communities groups. So it was a pilot project that ran for 3 years. However, what happens quite often is that the funding stops, but the issues don't stop, you know, and the work must not stop. And so that's why I set up The Weight UK, and it is culturally competent fertility support community that is rooted in providing equity and empowerment for Black and global majority communities. And so it's really about breaking the silence and providing that advocacy, but empowering people on their fertility journey. So these may be people that are, you know, having womb health issues, or it may not always be the woman. So it may be that they're in a relationship and, you know, it is the partner that has this male factor infertility, but they're somehow thinking, hold on a minute, I've got womb health issues, or there's this male factor infertility issues, and I need some support. And what we found that early intervention is really, really crucial. So we want to not just target the people that are already on their way, the people that maybe do have adenomyosis or are having heavy periods and have got fibroids, and actually educating and informing them about the potential impact on their fertility and reproductive health. So it's a long piece of work. I'm dedicated to it. It's not going to be a tick box exercise, you know, as unfortunately it can be when it's not a Black led or global majority led organization doing this work. We're providing emotional support, connection through community and advocacy. So we really want to sort of celebrate the diverse experiences in fertility. You know, there's not a one size fits all, and so it's really important to have those culturally safe spaces for people to access support and honour their lived experiences. So The Weight is set up to provide that community-led inclusive support, you know, and we do that through resources and providing tools, education and raising awareness.
Yeah, that's really good, and I love the name of the organization. So what made you come to that that name? Because I think I know what it is, but going through lived experience myself, I think I lean into that name. Can you just explain how you came up with that name?
Yeah, so I think it's going to mean different things to different people, so it will resonate, because I think, you know, wherever you are on this journey, whether it is that you're dealing with womb health, reproductive health issues, or you are, you know, on a fertility journey, there's waiting involved. You know, there is this is an exercise in uncertainty, or you're dealing with waiting a lot, waiting lists, you know, and I think we've both spoken about, you know, the dreaded waiting list, and we hear more about that in the media, you know, and thinking about what the government's policies are in regards to trying to tackle some of these issues on a wider scale. So the wait, really, I mean, like I said, people can sort of make meaning of it for themselves, but the wait is the wait to get the diagnosis, the wait when you're waiting for treatment, the wait if you're on a fertility journey and you're waiting for that rainbow baby, the wait to find out, you know, if your eggs have fertilized, the wait. So, you know, people can add whatever they want to what the wait is, but essentially it's something that many people would be able to identify with in the waiting that happens when you are living with womb health and reproductive health and fertility issues.
No, I think that's a great name, and I think just instantly when you understand what you're trying to achieve, and then you listen to the name of the organization, it just makes so much sense, and it almost makes you feel that's the right organization to go to, because you understand the weight and the frustration and the fatigue of going back and forth to the doctors. And and one of the things that keeps coming up in the reports that we've done and the focus group is not being heard, wait, and not listening to people increases the waiting list. So when you could have got referred earlier, instead of, I don't know, 2 months, it's probably about 8 months, because no one's listening to you as a woman of color or a woman of the global majority. So I think, it just you lean into that.
Yeah,
But
absolutely.
also, what is your core values and your goals for your organization?
Yeah, so I've spoken a bit about it in terms of the equity, equity in fertility care, because there are long-standing gaps and disparities within fertility care, particularly for Black women, Black people, but also other global majority communities. So it is about bridging those gaps. It's about providing equitable services. Like I said, it's not a one size fits all. So if you were to ask me, a value, equity is definitely one. Then it is about being community led, because when you are community led, you're centering the community's needs, and that's something that often isn't done within the services that I have accessed and the people
Yeah.
that I've worked with have access. So to have community led services is really making sure that how we design and how we deliver these services are informed by our members, are informed by the community that we serve, because essentially at the end of the day, that's how we can honour the lived experiences and provide the right services, at the right time. And then I would say trauma informed. Now, as you know, I'm a therapist, and so, thinking about not just how things impact the body, but how things impact also the mind. They're not having that split, which, the medical model can often do, is split the body mind. And so it's thinking about the trauma, working in trauma informed ways that also takes into account the stories, the histories that people are holding in their bodies. And so really, really wanting to provide holistic care, because some people may be having hormones, during their journeys, but also really value alternative treatments or complementary therapies, or have different frameworks for understanding and treating their illnesses and symptoms. So, when I talk about trauma informed care, it's educating the healthcare professionals to work specifically with our communities in a trauma informed way, because we are impacted by racial trauma, medical trauma, and different forms of trauma.
I like the fact that you're covering those things, because it is traumatic, especially when you haven't been treated correctly. Even if you've been treated correctly anyway, it's quite a dramatic journey. So to have that racial trauma on top of it, and not to take into consideration the trauma that they've caused you because of delays and the way that they deal with you, especially if you have to go to the hospital point of it. For some women, it's been a horrific journey. So it's good that there's a support that you can provide for these ladies. So at the end, we will be capturing all the data and information that people can contact you for, to join the support group, as well as, if they need therapeutic input from you, where to contact you as well, because I think that's vital. And sometimes, especially if you feel that you're doing this alone, hence the reason why we're calling this Tabooless and Unmuted, because a lot of people doing this and this journey alone, they don't feel that they can have that conversation with many people because they don't understand. They feel shame. They feel that, why is this happening to me? So that therapeutic support is going to be imperative, and especially you understand. So, you will be getting the information so where we can find you. You mentioned there were some gaps that you feel that when people are going through the fertility journey, what are those gaps? Can you just name a few? that you feel
Sure.
that there's no, equity in there?
Yeah, so we spoke about waiting time and referrals, and what we're finding is that black women in particular are having later referrals when it comes for fertility treatment. So there's already a disproportionate number of black women who will be suffering for things like fibroids, which is a womb health issue, which affects your fertility very often. And so if you're having delays in being referred, these are part of the gaps. These are why we're seeing worse outcomes for black women when it comes to fertility treatment. You're being referred later, you're accessing treatment later, whether that's treatment for your womb health issues, fertility issues, or fertility treatment, and you're also being referred at a later age. So, these are some of the gaps. There
And
is
then,
also gaps in terms of, sorry, go ahead.
no, I was just going to say, because I remember when we had the meeting on the 1st of February with the consultants, they were saying that women are coming to the gynecological side for fertility treatment later. And then it almost felt like it was a bit of gaslighting, like to say, well, you're coming to me late, or your doctor's not making the referral. And then, by the time you can get to the consultant, and then there's that lottery fund in terms of getting NHS and fertility treatment as well. So the cut-off period is it 40?
It really does depend on your ICB, so it is a
Okay.
postcode lottery. So depending on, your area where you live, it will have different criteria, unfortunately, that it's not standardized, and that's part of the problem.
I think, and one of the things I picked up from having more and more of these conversations is the gaslighting is something that needs to stop.
And definitely, a lot of women experience that, unfortunately.
Yeah, I think it's a new word I keep hearing associated with anything to do with the doctors, hospitals. It's gaslighting. We talk about microaggressions in the workplace and so forth, but gaslighting is something I keep hearing within those types of fields in terms of the health sector, and it creates more and more frustration for people.
Yeah, it really does. And coming back to your question about some of the other gaps, so there is gaps in terms of the access to donors, so donor eggs and donor sperm that are from ethnically matched backgrounds. There is such a lack of donors, particularly in the UK, for black people. So many people are being forced to go abroad, and having to navigate all the complexities of that in terms of donors and surrogacy, donor eggs, donor sperm, surrogates. So that's a very crucial gap that exists. Also, there's a gap in terms of the live births that result, from fertility treatment, the success rate. Some of the reasons we've already alluded to in terms of later age, advancing age, being referred, obviously it's more difficult, especially particularly if you're going to be using your own eggs, So what they're finding is that the success rates for black women specifically are less. So, we could be here all day if we were to list individually the various gaps, but what we're wanting to do is bridge those gaps and, not just take them as statistics, because, that doesn't have meaning, and that doesn't honour the lived experiences of the people that are impacted by these things.
Okay, no, we can talk so much about this. Like you said, it'll be all day. So, and these are some of the things, the gaps that you're trying to address, and some of them are going to be easier than others. Like you were saying, if you talk about the lack of egg donors and sperm donors and surrogacy, is there something in terms of a call to action from the community that we can do to assist with that? Because I don't think anybody would know where they would go. I know we know about sperm banks and so forth, but I don't think I hear anything about really egg donations, really and truly. You might see something in the back of a magazine maybe, but who reads magazines nowadays? It's all online. So yeah, is there something that us as a community could do?
Yeah, I think, this is why the weight was set up, and it's to increase that awareness, because there may be people that are willing to donate eggs or sperm, there's because there are people that are wanting to receive that, most definitely, but you may not come into contact with that until you're struggling, until you're trying to conceive and you're on a fertility journey, and then find out that actually that's the route for you to to become a parent. And so what it is about normalizing these conversations. Partly what we're doing here, this is part of the work, this is part of the call to action, to break that kind of legacy of silence that can exist. We don't talk about certain things within our communities. Well, this is, tabooless and unmuted, so we're talking about it, and we're wanting to spread the word. We're wanting to get the message out there, because it will impact our communities. And so I think that's it. The work also needs to be done within the communities as well as in the systems that are that we do access and we are oppressed by.
The end, we'll capture your information. Be ready for the number of calls, because hopefully this will go wide and far so that people can get that support and make people think about their journey or a family member's journey or their partner's journey, and give them hope that there is other ways that they can, fulfill their dreams, the rainbow baby, like you said. And, but I think this is where we start. This is where we start with the conversation, and hopefully we can collaborate with other organisation groups that can drive this conversation forward.
Sorry, just in response to what you were saying, I said that would be the dream. We also want to go into schools. We want to target people at an early age. We want to be able to start these conversations earlier, like I said, to be able to normalise it. So, working together, partnerships to be able to do this in our communities, I think it's crucial to this work.
I think what's going to be interesting, because I've been working on a piece of work to do with intergenerational, which is part of this, and looking at how do we start the conversation about preconception, which means going into schools, like you said. The concerns would be, you don't want to go into schools and then upset the parents, because they're going to be assuming or maybe thinking, we're like, what are you talking about having babies for, with my child for? So I think maybe a way forward is to maybe gathering school parents first and saying, this is the conversation that needs to be had, even if we don't have it with the children, but you have it with your children, to take these things in place. And children are starting periods quite early now. So if there's things that not seem normal, and that's the other conversation we wanted to have as well, what is a normal period, to look at the signs of imbalanced hormones, and is there something going on? Because some people are telling me the children are having severe pain and periods and heavy flows at such a young age. I'm like, is that normal? Is that something we need to be... Sorry.
These are questions that I think do need to be had at an age appropriate level, because, of course you target the age of the child, and people are having sex education lessons, lessons about biology. This can sit alongside a lot of these things. When I was at school, it was PSHE, personal, social and health education. So whether it's still called that or not, show my age. But yeah, I'm not sure. But that would be sort of like, the space where you would think that some of these conversations in an age appropriate way could be delivered. And then in terms of the periods, there's such a wealth of information. There's some fantastic organisations doing work out there about symptoms and the different diagnoses and conditions, where people can find out what is normal in terms of periods and their reproductive health. So I know, for one, there's Wellbeing of Women that has some fantastic social media posts about periods. I can say what was not normal for me. So painful periods was not normal for me. Being up in hospital every month because I was on my period and I was in so much pain, that's not normal. Heavy bleeding, missed periods, sometimes where it's like, periods are intermittent, there's different names for these things. Those are not normal. But I would want people to be informed by medical professionals when it comes to this. So to really look at some of the actual medically based information that's out there about periods and what's not normal, because it could relate to things like fibroids, adenomyosis, endometriosis and other womb health and reproductive health conditions. So, if somebody is really young, or if a parent is worried about their child, they can go online and look at some of these things. But the main thing is that you're talking about it, you're communicating, because if I couldn't talk to my parents about my periods, and that includes my mum. You know, we just didn't talk about these things. So I think, you know, a lot of what needs to happen is that to have these conversations, parents need to have these conversations with their children, and then, you know, then they can find out more information and get medically informed opinions, and then also access support that's needed. They're at the stage, come to the wait, you know, if they're at that stage, get the support and resources that they need if they're at a stage of starting a fertility journey, which, you know, for some will be sooner rather than later, you know. So there are a lot of resources out there, I think, that people can access, thankfully, when it comes to what's normal and what's not normal.
There's some great information, and I think there is a lot of resources, and all of a sudden in recent times there's a lot of coverage in the news about women's health, women's womb health, and we all know that the women's health on the agenda is not high. It's very important to have that conversation, and if we can have those conversations earlier. And I know culturally it plays a lot in this. It's not just obviously with the doctors and hospitals, it's also having the conversation with your mother or your grandmother or so forth, because that's something they went through but didn't say. That's a problem, and this is another reason why we're having this conversation, so that parents and grandparents can have conversations with their granddaughters and children, so that they can share knowledge and information, and then the child can go to them if they're feeling something rather than suffering in silence, and get earlier support from their doctors. And I think that's part of the cycle of where we're at, isn't it?
Yeah, and you use the word cycle, you know, symbolically. Yes, this is what we're talking about, you know, these cycles. So definitely, you know, if it's possible, it shouldn't just be left to the because you know, there's times when it may be your partner who has to run to the shop to get you sanitary towels because, you know, your periods are so heavy, or it's accompanying you to A&E because you're in so much pain, or it may be your brother, you know, it may be a male relative. And so I think it's really important to include men in these conversations as well.
And then the husband, the father, the boyfriend, or whatever the case may be, might have to take the reins for a minute, because sometimes those periods can really take you over. And if it does have you in hospitals, how, you know, you need to understand, because not understanding increases the chance of relationship breakups and things like that. There's a lot that goes with it. And then also feeding into work, you know, when you feel working, how it impacts your working life. The embarrassment, the calling in sick. Unfortunately, and a lot of people have also said that even if they speak to their female manager, they don't understand either, which you would expect them to kind of have some kind of empathy, maybe. But, you know, it'd be good when we put this out, if people want to make comments about their experiences and, you know, what they found. So, because it will only increase our knowledge and increase what people need as well. So if people want to comment on this comes from a place of just trying to help and advocate for people and empower yourselves to ask the right questions with the doctors, so that you can have a fast track rather than the slow track. And there's ways that we can do this.
It's important, you know, because everybody's different. And so some people may be having conditions like endometriosis, fibroid adenomyosis and other conditions, and not be symptomatic, actually. You know, not everybody is in pain, although it is, you know, a common symptom, or, you know, the heavy bleeding may not be severe. It's important to acknowledge that people experience things differently. However, it's important to pay attention, one, for your own well-being, you know, because if there is some sort of issue going on and perhaps you're not aware because perhaps you're not symptomatic, or it doesn't have that severe an impact on your day-to-day life, it's also about the progression of that illness and what that may look like. You know, imbalance in the body isn't a good thing, you know, if we just look at it from that perspective in itself. So being aware, it empowers you to be able to do something about it. You know, you can then make an informed decision. If you're speaking to medical professionals, you know, you're having conversations with friends and family and loved ones about it, you're getting more information, and then you're accessing help Now, if your body speaks to you and you have been alerted about these conditions, you will know. You will definitely know. And in that sense, again, it applies in terms of the progression of the illness, the damage that it may be doing. For a lot of people, not everyone, when they want to start a family, for instance, it's important to be aware about your womb health because how it will impact your fertility. And so I think something that we need to speak more about is the impact on fertility, because like I say, bringing it back to the work of the Weight UK, bringing it back to the disparities in fertility care, this is what people are finding, is that they are finding later these conditions, their womb health actually has a detrimental effect on their fertility. And therefore, if you are forewarned, you are forearmed, you can do more about it, you can have more options rather than waiting until things have progressed, or you're quite later in age and actually time is not on your side. So I think for those reasons, sort of mainly, I would say we need to be paying attention to our womb health.
Yeah, it's crazy to think, I'm not saying every culture in the global majority, but the conversation when you get to a certain age, don't come back here with no baby. And so therefore that's the kind of a focus. And then it's your education, your career, put something behind you, and then you get to that point, the work climate's changed a lot. And then another thing is when you do probably see symptoms, you might not want to go to the doctors because you're thinking, my manager, I need to do this, I need to do. There's always something, or we're always looking after somebody or caring for something. So we always end up putting ourselves on the back. And then when it gets to the point of, actually, I need to go and do something because I can no longer cope with the pain, or I can no longer cope with this, or whatever it might be, then you start your journey then. So, like you said, it's really imperative that we do that conversation, have that conversation, preconception care. It's not to say anything to do with encouraging anyone to get pregnant early. It's just making sure that as we focus on mental health, we focus on physical health and heart and things like that. And the womb is part of the body. If we don't deal with it now and look at it and be informed, like you said, the heartache you could have when you decided to have that family.
Yeah, and it also applies to menopause as well, because if you are having certain conditions, how that then affects your menopause too. So it's looking at all the life stages of a woman's health, right across from when she's born right up until, when she's older. So actually these things follow us throughout our life course. So we want to be thinking about healthy menopauses as well, how we can prepare for that too, because the time will come.
Yes. So are you saying, so if you have some womb health concerns, it has an impact on your menopause? And is that the connection between your hormones? Because the hormones has been disrupted somewhat, where you may be having the womb health concern, be it, adenomyosis or fibroids, and then that could have an impact on how you go through your menopause. Is that what you're saying?
There's got to be some correlation there. Some people will have early menopause, go through early menopause, for example, and they may not be your typical ages that people go through menopause for example. So what I'm saying is paying attention to your womb health at an early age also impacts your menopause. We want to be able to have healthy menopauses. We want to have our hormones balanced and regulated, and how that will impact our menopause. These things that we can try to do for ourselves and to get support around, to access the right support, whether it's nutritional support, therapeutic support, it's body-based therapies, there's many different things there. So we want to be able to have healthy reproductive years, but also healthy menopause years as well.
I think what we've discussed there, we will be looking at getting experts that can speak to some of the things that you've mentioned there, that can support people that are going through the menopause and how to balance hormones. So we'll hopefully have some experts. So keep coming back and hopefully we can provide you with the information to help you. I think you mentioned one thing. What is the most common misconception about womb health that you've often encountered?
That's a difficult one now. I'm thinking a bit on the spot with that one, if I'm honest.
Well, you
I
kind of
guess,
mentioned before that everyone goes through pain. If they have the fibroids or if they go have that, you assume they're in pain,
yeah,
and
yeah,
that's not
yeah,
always the case.
exactly. And that's not the case, actually. That's not the case. Not everybody will, with endometriosis, will have pain, you know. Not everybody's going to have those same symptoms, I think. So it's also understanding what is normal for your body and
Mm.
then, cross referencing it with actually the medical information that is out there and actually consulting with medical professionals as well. I think when I was growing up, the misconception that I encountered was around periods being painful. So I just believed that periods were supposed to be painful because that was my reality, you know. And now, we know that that isn't the case. We spoke about work and some situations where you may have female manager and will actually they may not know the full extent of what you encounter if you do have painful periods because they may not have painful periods. Periods may not be such a significant event and debilitating thing for them. So I
Mm.
think there's misconceptions that everybody's periods are the same when they're not, and that all periods for me are painful. When I learned that actually not everybody's periods are painful, I was just astounded.
So what would advice would you give to someone that is going through either pain, a lot of pain or heavy periods and it's impacting their work, how they should approach work? Because sometimes you might not have a female manager, you might have a male manager. Do you have any advice on that?
I mean, we're talking about, we're going down sort of the disability, reasonable adjustments, and looking about in that sort of territory, really. Because if we're talking about illnesses that you have suffered with for over 12 months and they impact your day to day ability to carry out tasks, then by definition, it's regarded as a disability. So, you may want to have a conversation in regards to occupational health. Depends, of course, how supportive your manager is, but about whether there are reasonable adjustments that may make things easier. And that may start off as a sort of informal conversation where you might say, oh, okay, perhaps when I'm on my period I need to have sort of kind of later start times, or things like that, but just making them aware about the impact that it has on your life as much as you are comfortable to disclose, because of course disclosing disability easy for everybody in themselves may not see it as a disability. However,
Yeah.
if it's impacting on your work, then I think it's important for you to feel supported in your workplace as well. So to start that conversation, it may be you can bring in a supportive colleague, you may be that you can bring in somebody that you feel safe with and trust, who you can also have that conversation with your manager, or join a union. Definitely join a union because they can provide extra support, as and when it's needed around disability in the workplace. And then see what they are willing to accommodate, see what they are willing to accommodate. If you do need to take further action, it's helpful if you are in a union, but you may be surprised. It may be that you go through the occupational health process and actually they, especially now where there's some more awareness around periods and menopause, shall we say, where they can put things in place to make it more easier for you to work, and so that you're not at a substantial disadvantage.
That's great advice. Yeah, I went through the similar situation. We had the occupational health, and obviously I just said that at this point of time, can I work at home? And obviously, if it wasn't, sometimes it will fall on the weekend, so I'm okay. And then if it falls in the middle of the week, can I work at home? So they did allow me to do that, so make those a reasonable justice, because I mean most people are working from home anyway, so some people might feel more comfortable with being at home, but then if you're in debilitating pain, that's a whole different ballgame. And how does that impact their sick leave and things like that? Because if you can't work, you can't work. So that's something that needs careful consideration. And also, obviously, this is more focused on black women's womb health. We all have isms and schisms when we are at work, and how does that impact even further? If it's a white woman, you may not feel any kind of way just to say, look, this is what I'm going for, but we know we've got that additional stress being a black woman in the work if you're in that type of organization where you're dealing with microaggressions and there's all this kind of thing and you've been highlighted differently, because at one point some people will start to look at you and say, are you using it as an excuse? Not always, but it can be the case.
Yeah, that's a
So
really
that's
sad.
sorry.
That's a really sad state of affairs if that is the case, in this day and age. And I'm not saying that it doesn't happen, but we would hope that people are more disability aware and inclusive to not do that, but not to say that it doesn't happen in the shadows.
And then I guess also I think some people put it on themselves because they don't want to take that time off because they feel like, oh, I'm going to be deemed a particular way because I'm black woman or Asian woman. So there's that battle of taking time off to go to the doctors. There's that battle within themselves, like, I'm in pain again, I'm going to have to say this again. So there's that additional, I would say, stress trauma because you're on anxiety.
It is stress. These are some of the barriers to getting, support that these are like sort of the cultural factors that impact on us specifically in our cultures. And what I will say is that, if you can have allies, if you are in a minority in the workplace, or there are people that you trust and you can have those conversations with, because it's a very lonely place to be otherwise. And health is wealth, and so we have livelihoods and we need to make a living, but if you don't have your health, you're not going to be able to do that. And so it is also about a mindset change and investing in yourself and investing in your health. Now there's so many pressures that people will have with cost of living, financial pressures, family lives, etc. But you can't do the work if you're not healthy. You can't do the work if your health is failing in such an extent. And maybe that's the situation. Maybe for some people, they're not able to work actually. There are many people that suffer with these debilitating conditions and they're not able to work, because it is a disability, and many people can feel that and experience it that way.
What I love about working with yourself on this is because of the fact that you've worked with so many people and you've got your lived experience, you've got the therapeutic side of it, you give a wider lens to what's going on in this journey. My lens is not as wide because I'm the person that will say something needs to be done. How do we do it? And, working with you and your expertise and your lived experience, knowledge and skills and the meetings that you've go to, because you've been representing at, is it parliamentary groups as well and conferences? So you know what's going on the ground in terms of, the women that have going through it because of the supporting the women, but also you're at the levels of the strategic level where you're at those meetings. Can you speak to that a little bit to say what's going on and where they're trying to move to and what can we do to support that movement?
Yeah, I think there is a all parliamentary APPG group, people's group around black health. And so one of the leading charities based in the UK that works with many of the ICBs is calling for evidence. So there is a surveys that they're asking people from the black community to complete, and this is specifically focusing around fibroids and womb health. So I think that's what we can do to help. We can feed into those surveys and that research that is being done, because that's what's going to be seen at those levels, and those are the things that are going to influence policy, and the policy that then impacts us and how we are treated, how we access the support, the funding that is available, etc., etc., etc. So that is one of the sort of pressing issues at the moment. There is often a lot of talk, and I think, we want to move from talk to sustainable action. So where I am willing to sort of work with anybody who is also of that mindset in terms of the sustainable action, and maybe that is where the community are creating the resources that we need. Now, we need to be resourced to be able to do that. That is often the issue, because we know what we need, and if we are designing it we are creating it, co-creating it for ourselves, then we are sort of best placed to meet our needs. But we need the resources to be able to do that. So I think it's about also funders, investors, within our communities, being able to provide that support so that we can bring about and implement these changes and services that we need to address these issues within our communities.
That's an important factor, because we've often spoken and we've done groups, so we've done things where we say, yeah, we're doing this, we're doing some research on that, and we don't necessarily show up. And I think I put a post after one of the focus groups that we ran, and how do we expect change if we don't show up? We've spoken about actually the medication that people are being given for helping these conditions, but it's not based, we're not showing up to do the research, helping with the research and giving the information, and then we get what we're given and it's not what we need or want. So how do we align that? I did a survey not so long ago on the experiences, and the outcome was pretty poor. So as much as the health or whatever it might be the government needs to do, we can only create the impact if we come together, collaborate, and in a voice together to show this is what we need, not one or two. You said you've been at many meetings and you're the only person there in the room that or of the global majority that are saying what's going on for what's happening on the ground. But that's not enough. We need to be there with you. We need to create that change. We need to, like in the record industry, it's off kilt a little bit, but if you go to the record industry, I've got this demo, they're not listening. You create the impact on the street and see the vibe, they're coming looking for you. And that's what we kind of have to do. We need to create that impact and say, okay, we've got tens of thousands of people who are saying this is what's going on. We can't really ignore tens and thousands of people.
No, there's so many organisations that are doing work, and I think particularly in the maternal health.
Yeah,
in
definitely.
the maternal health field, that's kind of exponentially sort of just blown up. What
Yeah.
I find the tension there within that, and is not wanting to take away or dishonor anything of the amazing work that's being done in that area, but it's not working in silos. It's like you said, coming together, because we are actually stronger together. It's not one here, one there, one here, and then, you're trying to recreate the wheel. No, we support what already exists, and if we need to expand, then we do. But we need to come together to be able to build up, from the foundations that are already there, and work together. I think collaboration is key in this conversation.
Yeah, hopefully we're demonstrating that, because I don't know, prior to January this year, I didn't know who you were and you didn't know me, and we've now worked together a few times now, and we're continue to work on some other projects on this agenda.
Absolutely. Well, all I can say, Caroline, is I've felt like I've always known you.
No, yeah, and likewise, it's crazy how we've gone on the journey. I've learned so much from you as well, and obviously you've empowered myself, and you've added to the work that I've done with Upfront Conversation. And obviously, like I said, it only made sense to keep having this conversation. And there's other groups that we've worked with, Soul Purpose 360, who is a women's group for Black women, which is about empowerment and building confidence in Black women. So we work closely with Palma and that, who's actually doing a Women and Girls commission to look at these factors plus other factors. So what I can do is, when I put this out, I will add Jen's organization and her information. Soul Purpose 360 is an amazing organization, and also my organization. And if you want to work with all of us or individually, reach out and say how you can help and what your organization, because just keep having these conversations is going to be so powerful. God forbid if Labour gets out and then we've got the Reform Party that comes in and it's not political, how low would this agenda be? But then you might surprise us. You might surprise us.
I'm not wanting to imagine. I'm not even wanting to imagine worse, because we're not we're not starting from a level playing field. So, it's more equitable action that we need to see.
No, definitely. We definitely need to see change. We need to see change. We also need to see change from community leaders that run organizations that are speaking for us, that get the funding, and they need to do more. And I know it's a hard task, but we're looking towards you to actually feed in the facts and not just like, okay, yes sir, 3 bag 4 sir, when the community is saying different. Don't just receive the funding and and make no changes. And I can think of a few organizations that do that. Obviously, you need to get paid as well, but there's so many different subject matters and areas that I think they could do a little bit better. I don't know if you find that yourself.
I think working with community leaders is crucial. It's so crucial. And what I also sense is that, members of our community feel this kind of research survey fatigue, and so it is about working with the community leaders and the organizations to be able to co-create the types of interventions, the types of methods to be able to reach those people, to be able to engage, for them to want to engage, for them to feel as though their voices are also included and heard, because in that way, we can better fulfill the needs and probably get better engagement in what we're trying to do within our communities. So there is some people who really have their finger on the pulse and they've managed to find those methods, and I think we need to again work together so that we can learn from one another like we've been doing, and so that we can use these within the different things that we are doing, within our communities, and bring it together.
Yeah, no, definitely. Well, we will continue the conversation. We will continue to collaborate. We will continue to welcome people upon this journey, and support the Wait UK. You've got an event coming up. Do you want to speak to that a little bit as well?
So this will basically be launching to the community, and we want to be able to let them know that we're out there to raise that awareness, speaking to many of the things that I said about our values, so that equity, that advocacy, and that community-led, trauma-informed way of providing fertility support. So it's not just about, emotional support. It's about creating a fertility community, support community that really does sort of break down the taboos and the silence. And we want it to be culturally competent, So we're empowering our communities on their journeys as they navigate fertility challenges.
Great. No, I'm hoping to come and see the work that you do.
Please do.
And support yourselves, and I'll be pushing it out amongst my networks as well. I just want to thank you for your time and your knowledge and taking this journey with me, Jen.
It's been a pleasure to join you, and as always, have these conversations, and I hope that they do reach the people that need to hear them.
I'm sure it will. I guess before we end this, what takeaways can we give to the audience?
Look at some of the resources that I mentioned as well, and we can provide further information about those resources as well, to go and find the medical information so you can check.
Take somebody with you who can give you that strength to speak up and don't let the doctors or consultants to gaslight you.
This is how we want to empower our community and people who access our support, to be able to have those tools and resources, to be able to advocate for themselves, but also receive help from advocates as well. No, absolutely. I think it's crucial because, we're at everybody's at different starting points as well. We're not all, some people will feel very confident going into the GP surgery. Some people, maybe English isn't their first language, and you've got those language barriers and different things like that. So they might need a bit more hands-on support. So it's really crucial, I think, for there to be awareness of what is available out there, and for people to know as a takeaway that they're not alone and there is support out there.
Keep coming back, and hopefully we can give you the information that you require to help you on your journey. And if you want to pose any questions, please email me at info@upfrontconversation.com, and we can ask the expert for you and pose it on the next podcast. Again, I wanted to thank Jen for being on this journey with me. We'll come back with the next ones.
Look forward to it.
Thank you. Take care.
Thank you. Take care.
Introducing the Wait UK, fertility support for Black and global majority communities. Join us for our launch event on Saturday the 19th of July 2025 from 3 to 7 p.m. We're here to break the silence around fertility, create space for real, cultural conversations, connect through shared experiences, offer resources that truly reflect us, empower you to navigate healthcare with confidence. Whether you're navigating fertility challenges, supporting a loved one, or seeking culturally grounded information, you belong here. We provide in-person and virtual support groups led by those who've been there. You can access educational tools and info designed for our communities, advocacy resources to help you claim your space in the system. For more info, follow us at thewait.uk. Email thewait.uk@outlook.com.